What's up, y'all? This is Carolina Doc PT, and today we're going to be talking about two issues that you need to be aware of after you've had a knee replacement or a hip replacement. And really, it could be after any orthopedic surgery, but we primarily are concerned about these, talking about knees and hips. And those two things are, one, the signs and symptoms of an infection, and two, the signs and symptoms of a blood clot. So those are really the two biggest issues that you are concerned about and are wanting to be aware of after you've had those types of orthopedic surgeries. They are both, I'm going to tell you right off the bat here, they are both rare. They don't happen a whole bunch, although I will say we're starting to see a few more of those now, for whatever reason, and I'm not entirely sure what the reason is behind that, but it just seems like I can think of more patients recently that have run into these types of issues, more really than I've seen in multiple years before now. So kind of strange. So but I wanted to make this video just so that you're aware of these, and what you're looking for, and what the signs and symptoms are that you're looking for, because it's really important after you've had a surgery that you at least are concerned and are thinking about these kind of things. But again, not something that you should necessarily be staying up at night worried about, but it's something just to be aware of. So first, we're going to talk about infections and the signs of those. The main thing that your surgeon is typically going to say that he is concerned about with an infection would be looking at your surgical incision site and what is happening with the drainage. So if there is a ton of drainage, like the bandage looks like it is just going to come off because there is so much drainage there, then that's something that generally the surgeon needs to take a look at. You can give them a call. You can send them, a picture of it on text or something, but they generally are going to want to have eyes on. You may, need to go and actually see them, or go to the ER if this is if something that you're noticing over the weekend. That's kind of relatively recent that one sign would be the main thing that the surgeon is looking to see. Prior to that, we had always traditionally said, well, an infection, you're looking at, yes, drainage, that's an important one. You're also looking at, could be increased swelling local to the incision. You can have increased redness local to the incision. You could have some streaking in the skin local to the incision. You could have heat that is local, again, to the incision. Sometimes if it's really bad, there's a smell that's associated with that. But usually the smell, like if you have an Aquacel dressing, the non-removable type of dressing, you're probably not going to be able to smell a smell there. Maybe, but that's not the number one sign that we're looking for. We're looking really drainage. And so a lot of times patients will ask and be concerned about seeing some blood on their non-removable dressing that they have on after their surgery. This again can be a knee or a hip. You're going to get some drainage there. Having drainage by itself is not what we're talking about. Like, it is not uncommon to see, quarter, $50 sized bits of drainage, maybe more so like at the knee as you're kind of working on bending that knee, and having that, a little bit of blood coming out from that, or, you may have some left over from when you left the hospital, that kind of a thing. Having that on the dressing by itself and in and of itself is not an issue typically. And sometimes what we'll tell patients, or sometimes something that I might even do if I'm seeing this person at our clinic or whatever, is, you can take a magic marker and just draw around where that drainage is. So then that way, that allows you to kind of get an idea, is this drainage site growing, that kind of a thing. But again, what we're typically told by surgeons is when they're talking about a lot of drainage, they mean that the entire dressing is sopping wet and it looks like it is going to come off because there is so much drainage. If you get into a situation like that, you're going to want to call your surgeon. If you are not able to go and see that surgeon, then you're likely going to want to go to the ER to have them take a look at that. So that alone, as I say, can be the sign to do all that. Or traditionally, we would have said, hey, you're going to have, increased redness, increased heat, some increased drainage. You might even have a little bit of increased pain. That's kind of, again, everything local to the incision. You're seeing a lot of signs and symptoms around that incision. Then, yeah, that's probably something that you're going to want to go either to the ER or you're going to want to call your surgeon about. So that's the number one thing that we kind of go over with patients about is infections. For some reason, I don't tend to see as many of those with knee replacements. We tend to get more of those with hips for whatever reason in this area. I don't know, wherever you live, maybe the surgeons around there are a little bit different, but around here we tend to see that as an issue around hips more than anything. But again, as I said, it's rare. The second thing that you're wanting to be concerned about after you've had an orthopedic surgery, especially a knee replacement and a hip replacement, as we're talking about, is the signs and symptoms of a blood clot. So blood clots, again, they're rare. They do not happen a bunch, but they do happen. So the signs and symptoms of a blood clot are traditionally increased swelling to the lower extremity below the site of the surgery, increase heat to the leg, increase, like a lot of times it's warm or it's really hot. Again, local to that, or not local, but to the leg and the involved leg. Although that's traditionally where we're looking, is at the leg, but it really could be anywhere, but you're really mainly looking at that spot. Another sign or symptom of a blood clot would be increased swelling. So you're looking at increased, and then, I'm sorry, I think I said that, increased redness. So traditionally you would look at increased swelling, increased heat, and increased redness to that leg that you've had the surgery on compared to your other leg. Then that would be something you'd be thinking about for a blood clot. There's another sign that I've recently had 2 patients to experience, and that is going to be simply swelling by itself. So these patients that I'm thinking of and that come to mind, neither one of them had really increased redness. They didn't have really increased pain. They didn't have really any warmth to their leg. Their leg was just a little bit swollen, and it just was staying a little bit swollen, which was kind of unusual in and of itself. But when we had them go back to the orthopedist, just that alone wound up being their sign of them having an actual DVT, a blood clot. So that is kind of something that I've been seeing a little bit more recently. That is, again, not exactly to type. To type blood clot and the signs and symptoms you would see for that traditionally are, as I said, increased swelling, increased redness, and increased heat, all of those traveling together. But recently I've started seeing a little bit of just swelling by itself. And then another patient so this was just one patient, so I can't say this has happened a whole bunch, but had another patient who didn't have any of those symptoms, but they just had increased pain. And their pain really was around about a 5 on a 0 to 10 scale. It was things, they really couldn't do anything to make their pain go away. They couldn't really do anything, like there wasn't really getting worse, but it wasn't going away and it wasn't getting better. And so it was just kind of staying around about a 5. So that really kind of concerned me on talking with this patient. And we wound up actually sending this patient to the hospital. Turned out they had a blood clot. So that you can get some outliers. At the end of the day, it would basically be if you're having, some discomfort, you're having something that you're just not sure about. It's never wrong to call your surgeon up. But if you're specifically having the 3 traditional signs, which would be increased swelling, increased redness, and increased heat to your leg after you've had a surgery, that's something that you for sure want to call your surgeon about. If you can't get a hold of them, like it's on a weekend or something, then you're going to want to go to the emergency room to get that checked out and make sure that there's not a DVT. Also, if you have swelling by itself, or if you have pain by itself, and it's something that doesn't seem to be getting better, because over time, you think about it, you've had a surgery, your body is looking to heal you. So over time, if things are not improving, then that needs a little bit more further examination from a medical professional. So if your symptoms are just not improving, or certainly if things are worsening, then that's again something to look at. Get your surgeon to look at, or go to the ER about. But those 2 issues are the 2 things that you're really thinking about and are concerned about as being, kind of bigger risks from the surgeries of that, or orthopedic, typically involving either the knee or hip, typically knee replacements, hip replacements. Those are the things that you're wanting to be concerned about. Again, though, this video is more just for your education about what these are, more so than anything. Yes, we've started to see a little bit more of these types of things, but even so, the vast majority of patients will not deal with this. The vast majority of patients, this is not something you'll encounter. They're rare, but just because they're rare doesn't mean that they won't happen. So that's where you want to be educated about it, so that way you can know, okay, if I see these signs or symptoms, then I want to call my surgeon, or I want to go to the ER to get them to have them look at it a little bit farther, and then hopefully, as I say, they can rule it out and say, no, that's not a clot, that's not infected, you're fine. And so that's what you want to hear. So it is getting dark now, and so I need to go ahead and wrap this up. These car videos are very easy to do. I need to be back in the office doing these, but it's very convenient and easy to do this in the car too. So anyway, I hope that this video has been informative to you. Please let me know if you have any questions or anything in the comments below. And if this is information that you are thinking is beneficial to you and to your situation, then follow this channel, give us a thumbs up and a like on the video, and we will catch y'all next time. All right, have a good one.